So our next speaker is Jaime Seltzer. Jaime Seltzer is the Director of Scientific and Medical Outreach at the MEAction Network. Jaime's background sheds light on her remarkable work as a scientific director at MEAction, a nonprofit organization focused on bettering the lives of patients with ME/CFS and long COVID. Jaime is also a biochemistry affiliate researcher at Stanford Medicine at Stanford University. Her research is focused on infection-associated chronic diseases with a primary focus on ME/CFS and long COVID, and a secondary focus on disorders of mast cell activation. Jaime's research is crucial in understanding ME/CFS heritability, metabolomics, disease presentation, and its relationship to other neurological diseases that are often virally triggered. Her expertise and experience as a person living with the infection-associated chronic disease gives her a unique perspective, providing insight into symptom presentation and building trust into the patient community through consistent engagement, ethical principles, and the quality of work delivered over years of service. We welcome Jaime Seltzer.
Hello, everybody. Thank you so much for coming and for listening to my talk. I know that we've had a lot of scientific background and clinical discussions today, and I'm here to talk to you actually about an advocacy initiative in ME/CFS clinical care. I've been told that I have a little bit of extra time today, so I'm going to go into a bit more depth than I planned. But I will also be on the panel later. So if any questions occur to you as I'm speaking, I hope that you'll write them down and share them with me later. So my name is Jaime Seltzer. You've just heard all about me. I'm very pleased to announce that I was named to the Time 100 Health list, which acknowledges 100 people with the greatest impact in global healthcare over the past year. And we'll talk a little bit about how we got there and what that means for ME/CFS research, clinical care, and awareness. I wanted to also talk about MEAction itself, which is my parent organization, by going through some of the highlights of MEAction scientific and clinical and advocacy work over the years. Now, if this is on your phone, don't worry. I'm going to go into each of these in a little bit more depth. So even if you can't read the tiny font, we'll cover each of these aspects. So MEAction, or the Myalgic Encephalomyelitis Action Network, was founded in 2015, and it was founded by Jen Brea and Beth Mazur. The first big project that MEAction did was to petition the Lancet to retract the PACE study. For those of you who might be unaware, PACE was a trial that attempted to prove that exercise cures ME/CFS. As you've heard throughout the day, of course, exercise actually prompts symptoms in this disease, and it does have the potential to cause permanent decreases in baseline capacity. That petition netted 12,000 responses. In 2016, we held the first Millions Missing, and it's arguably the first large-scale protest for ME. It was in 12 cities worldwide, and then in that same year, we held it again, and it was in 100 cities and virtual demonstrations. In 2017, the Unrest documentary debuted. That was technically through Shella Films. But of course, MEAction had a great influence in creating, for example, the Unrest continuing medical education course that was associated with the film and that had a short medical education film associated with it as well. In 2018 and 2019, we did the Postcards to Doctors initiative. That was much like the Postcards to Voters initiative. If you're unfamiliar with that, people would handwrite postcards encouraging others to vote. In our case, we were handwriting postcards encouraging people to take the Unrest CME, and then later other CMEs as they got approved. The Postcards to Doctors initiative also had outreach to underserved populations worked into the initiative. wherein we know that this disease primarily is diagnosed in people of privilege because the diagnosis is so challenging to access. So we created a program that would identify neighborhoods with larger populations of Black, Indigenous, and people of color, and ensure that some of our postcards were sent to these locations. We also had a BIPOC outreach initiative, and we debuted the Chronic Illness Survey Adventure. We'll talk about that in a second as we move on to 2020. The Chronic Illness Survey Adventure was a survey of symptoms in people with ME, long COVID, POTS, MCAS, and HEDS. It netted over 2,200 responses and generated over 1.5 million data points. We have also done a great deal of press work since the pandemic began, and we're going to talk a little bit more about the work with Mayo Clinic Rochester as we continue. So this is a summary slide of all of the work, and we'll delve into some aspects of it shortly. So we met with Mayo Clinic Rochester staff, and we being myself and Ben Stuborger, who are with MEAction, and we met with Doctors Stephanie Graich and Ravi Ganesh at Mayo. After we had some preliminary meetings, we formed a working group, and we used that working group time to produce a grant, and we did win that grant from the Society to Improve Diagnosis in Medicine. This is a quality improvement grant, and quality improvement investigates the way that medical practice can improve and be measured over time. Then we also created a continuing medical education course, a peer-reviewed paper in Mayo Clinic Proceedings, a diagnostic and treatment algorithm with an Ask Mayo expert, and we also edited the public-facing page on MECFS. So I wanted to point out that we couldn't have done this without the right team. So it is not simply that we were able to interface with a large institution. It's that both Dr. Graich and Dr. Ganesh were very advocacy oriented and very oriented to change in terms of the way that infection-associated chronic illness was addressed at their institution. We were also driven by common values and practical goals. It's very easy to form a working group that does not necessarily get a great deal accomplished. All of us with advocacy experience or any committee experience are really very familiar with that phenomenon. But by having concrete and meaningful goals and objectives and timelines, that really helped us guide the work. We also developed solid and respectful relationships, and the fact that we had ongoing meetings allowed us to get to know one another on a personal level. I think that one of the most important aspects was that we both evidenced a show of faith very early on in the interactions when Dr. Graich and Dr. Ganesh described that the way that they would like to see practice at Mayo change. And I delivered results regarding changes on their website very early and very heavily cited. And that showed our respective willingness to engage and our respect for each other. In addition, our different backgrounds enabled us to rely and lean on each other when that was necessary. So in addition to that initial respectful relationship, I had developed a relationship with the Society to Improve Diagnosis in Medicine in a very similar way. Initially, I had reached out to CIDM in association with our BIPOC outreach initiative, and that was in 2018. So I was very well aware of underdiagnosis in Black people in particular in the United States, and I reached out to Dr. Ron Wyatt at CIDM. And he was able to be very helpful and attempt to provide me with some contacts. So we had this very reciprocal relationship from the beginning. Eventually, I was invited to give a talk at CIDM. This is all before the grant was awarded, to talk about long COVID, MECFS, and infection-associated chronic conditions. And In addition, Susan Carr produced a long-form article on this. Then we applied for the DXQI seed grant program at CITIM and were accepted. And then the relationship continues. Subsequently, at the same conference where Dr. Grach and I presented our final results for the grant, I was also invited to speak as a patient leader at the CITIM conference just at the end of last year. So I'm attempting to convey, and hopefully somewhat successfully, that oftentimes when you reach out for partnerships, you're offering something or engaging in something without necessarily having a long-term goal in mind, but that these can become the seeds for long-term partnerships that can be very fruitful. And oftentimes you reach out without any particular gain in mind. You have something to give. And I think that is a very good foundation for an ongoing collaborative relationship. So the aim of the project with Mayo was to improve knowledge of ME/CFS diagnosis, and we had two measurements we were planning on using. The first was improved concordance between referral diagnosis and consult diagnosis. That is essentially another way of saying we wanted to make the number of experts who knew what ME/CFS was and the number of generalists who knew what ME/CFS was a little bit closer to each other. And we were also looking for improved post-test scores on an educational module for our long-term CME. We also had the following three products in mind, which we mentioned in the summary: the diagnostic and treatment algorithm within Ask Mayo Expert, which is, by the way, a series of algorithms, treatment and diagnosis algorithms for different diseases. And it's available to people not just at Mayo Clinic Rochester, but at any Mayo Clinic across the United States, and to any outside subscriber to the Ask Mayo Expert platform. The public-facing edits on the page, and finally, the CME in the paper and Mayo Clinic proceedings. So now, once again, these are relatively small, so I'll take a moment to describe each of the results with you. The top left-hand side that shows three columns is describing the work that I did in order to offer recommended changes to the public-facing ME/CFS page. So in the first column, we would have the original language. In the second column, we would have the language changes that I suggested. And then in the third column, I would have my reasoning laid out along with citations and links that supported that reasoning. And I do believe that offering this work very early was a way of demonstrating that we were serious about collaboration and that we were intent on working very carefully to make that happen. That initial document was about 26 pages. Then on the right top-hand corner, we have the algorithm itself. What we have here is a number of different symptoms and recommendations for how to address each of those symptoms. While there are no FDA-approved medications for the treatment of ME/CFS, there are a lot of recommendations that you can make in order to mitigate symptoms. So this does include recommendations for prescription drugs, but it also has a great deal on management strategies. For example, when we talk about orthostatic intolerance, we talk about compression stockings and hydration and things like that. The Ask Mayo Expert algorithm, despite the fact that it's the least public, may in fact be the thing that I'm most proud of in this project because it also includes recommendations for severe ME and emergency room care, which others have done excellent work in. To the degree that I'm aware, I believe that this is the only diagnostic and treatment algorithm that contains such information. The Ask Mayo Expert on the bottom left-hand corner, this shows that it was accessed more often on average than other similar algorithms. The bottom center shows the Mayo Clinic proceedings paper with the PEM diagram and the diagram of different symptoms in our different systems of the body. And the last image represents the altmetric score for the paper. Altmetric is a measure of attention for a paper. It's not necessarily how many times it was cited. It's how many times it's been discussed online, cited, included in news articles, discussed on blog posts, and that kind of thing. Something in the 900s would be considered one of the more popular papers of the year globally, not necessarily simply in the ME/CFS field, but altogether. So these were our measures of success, which we did somewhat just discuss. The algorithm itself has been accessed more often. The concise clinical review has been discussed a great deal. And that is, by the way, before the Teach ME, Treat ME initiative launched. And the partnership aspects, which are maybe one of the more important aspects of all of this, is were we able to hold the relationship? And the answer is yes. We are submitting another paper very shortly, and we have a study that we worked on together that will be debuting very soon. So, of course, from an advocacy perspective, we wanted to build on that success, and we wanted to replicate that success at other institutions. So we began the Teach ME, Treat ME initiative at MEAction, which is moving us hopefully towards a model of collaborative clinical education advocacy. So there are some frame shifts necessary in our thinking to kind of take this to the next step. We know that there's a lot of incredible medical education out there in the world, but it's not necessarily being examined or looked at. We know that there are a lot of incredibly experienced clinicians and researchers out there, but expertise isn't necessarily enough. So the quality of the work and how impressive the person is who built it is not necessarily enough to spread the information far and wide. We've learned that institutional buy-in is incredibly important. If you, as somebody relatively high up in a clinical institution like a university hospital or a medical school, is being told that you need to learn something that you've never heard about before, or you've really only ever heard about in passing, perhaps one line in your medical school textbook, and now you're told, here is a module that we've created and you should share it with people and you should take it yourself. That is going to be a lot less effective than saying, let's build something together. So we created medical education as the center of our Millions Missing work in 2024. I believe many of our folks here are already well aware of what Millions Missing is, but just in case we have some newbies here, Millions Missing is the way that we describe our annual advocacy push every May in order to bring attention, awareness, better funding, better clinical care, more research to the field of MECFS. And so we are holding both in-person events and pushing for these long-term partnerships, similar to the work that we did with Mayo Clinic Rochester clinicians as part of what we're doing this year. So for in-person events, we are encouraging people to read the paper in Mayo Clinic proceedings and take the case-based CME that's associated with the paper. And in medical schools, we've developed a deck of Anki flashcards. These are a relatively common way of studying in medical school, and we've created an infection-associated chronic illness study deck that includes questions on ME, long COVID, POTS, HEDS, and MCAS, and also some questions on things like small fiber neuropathy and SIBO. The way that we're going to measure success is the number of views of the Mayo paper and the CME, and we're using custom QR codes to count these. But we will also be inquiring of Mayo Clinic the number of people who have taken the CME in April, May, and June. We are also going to be looking at the number of downloads for the Anki flashcards, the number of in-person Millions Missing events, and the number of longer-term partnerships that we establish with other institutions. In that vein, researchers at Emory, Mayo Clinic, Brown, Georgetown, and University of Montreal have all submitted letters of intent to engage on medical education projects. Some institutions were not able to submit letters of intent before the deadline, but we are still having conversations with them. Unfortunately, we simply cannot mention them yet. The following projects have been discussed: help with a new or developing MECFS and long COVID clinic or specialty center, diagnostic and treatment algorithms, training for nurses in MECFS care delivery and patient education, the creation of patient-directed materials, papers on best practices for addressing complex chronic disease, and funding training and medical internships for people for whom specialty in MECFS or long COVID is the priority. We're also doing outreach to institutions that serve Black, Indigenous, and people of color and Native populations. However, these institutions are critically underfunded, which is an obstacle to engagement. Finding specific funding opportunities and inviting them to partner has proved to be relatively helpful. And even though this is an extra push, nothing about us without us applies, and this is a very important and worthy goal to push for. Other healthcare systems of concern include veterans hospitals, federally qualified healthcare centers, and rural healthcare systems. Each of these systems needs more attention to diagnosing and treating people with MECFS and other infection-associated chronic illness. So I wanted to talk a little bit at the very end about why the Time 100 issue is important for us. I think that at a fundamental level, this is a kind of validation and a recognition of how far we've come. I've said multiple times that I don't really think this could have happened even a couple of years ago. So I intend, obviously, and we all should, to leverage this for additional partnerships, to push for drug trials, to push for better medical education, more research funding, biomarker trials, and so on. This is an opportunity to burst into the public consciousness with even greater strength and purpose. And I think it's an opportunity that we cannot afford to miss. What's next? And by the way, you will see a QR code that is to donate to MEAction. If you appreciate this work and would like to support it, I encourage you to take your phone out and hold it up with the camera on. But we do have the links at the bottom of the screen as well. You can go to meaction.net/donate. And if you'd like to hear more about our work in general, you can go to meaction.net/subscribe. So how do we intend to continue to keep this momentum going? We've applied for multiple grants in order to distribute subawards to all of the institutions that have sent us letters of intent with the purpose of collaboration. Our goal is to serve 5 to 10 such institutions to transform clinical care and medical education at their institution through close collaboration and through the creation of concrete products. It's not just about having conversations. It's about making things that can be shared and can live much longer than the partnership itself does. By opening the floor to new researchers and new institutions, we hope to broaden and deepen knowledge of MECFS diagnosis and care in the US and beyond. And there's a lot to be excited about over the next year. I hope you join me in that excitement. Finally, if you are a medical care provider, I hope you will join us in taking the CME. This leads you directly to the paper, but you will be able to see instructions for how to take the CME. If you scroll down, it is a 1-credit AMA, which means that people who are nurses, pharmacists, and clinicians, as well as other care providers, can take the CME and get credit for it. If you have trouble or if your phone is dead, you can also visit meaction.net/treatme in order to locate the CME. And that will also provide you with a direct link to the CME itself and not just the paper. If you want to contact me, this is how. If you are press, you can reach out to press@meaction.net. I am Jamie at MEAction.net. If you have general questions, you should reach out to info@meaction.net. And this is our generic thank you slide, but I can't overstate how much I mean it. The Time 100 health nomination and being honored is important to me at a personal level, of course. It's very validating. It's wonderful. At the same time, I think that it means a great deal for the field. And I'm very well aware that everyone who has ever engaged with me has taught me something important. And that is hundreds, if not thousands of you. So thank you for supporting me through the years. Thank you for supporting MEAction. And thank you for all of the work that you do every day to ensure that people with ME are heard and supported, and that they receive all of the help that they need in order to live the best possible life. Thanks so much, everybody.